Welcome to the deep dive. Today we're tackling a pretty specific area of canine health, hypertrophic cardiomyopathy, HCM, in dogs.
Right, HCM.
Our goal here is really to pull out the key info. What is it? Who gets it? And what our source material tells us about this, well, relatively uncommon condition.
Yeah, it's important to stress that uncommon part.
Definitely.
Mm-hmm.
And let's just start with the definition because it kind of sets up a puzzle right away. It's described as inappropriate myocardial hypertrophy of a non-dilated left ventricle occurring in the absence of an identifiable stimulus.
That last part is key, isn't it? Absence of an identifiable stimulus.
Exactly. A thickening heart muscle, but we don't really know why in dogs.
Well, not like we do in humans or cats even. We often have specific genetic mutations pinpointed.
Ah, okay. So in dogs, it's still a bit more of a mystery.
It suggests that finding those potential genetic factors is probably a big focus for researchers.
Makes sense.
Yeah.
So fundamentally, HCM in dogs means the wall of the left ventricle, that main pumping chamber, gets too thick.
Right. Concentric hypertrophy is the term.
And it's the muscle itself thickening, not the chamber getting bigger overall.
Precisely. The muscle mass increases, but the internal volume of the ventricle doesn't necessarily expand. It's really focused on the heart muscle tissue.
Okay. And when that wall thickens up, what does that actually do to the heart's function?
Well, think of the ventricle needing to relax and fill between beats. If the walls are thicker and stiffer...
It can't relax as easily. It's harder to fill.
Exactly. It impairs diastolic function, the filling phase. The ventricle becomes less compliant.
And if it doesn't fill properly, I'm guessing pressure starts to build up.
You got it. The pressure inside the left ventricle at the end of filling goes up.
Okay.
And that pressure then backs up into the chamber before it, the left atrium.
The one receiving blood from the lungs.
And over time, that left atrium often enlarges because it's dealing with this consistently higher pressure.
Wow, so it's like a domino effect. The source also mentions a couple of secondary issues, mitral insufficiency and dynamic left ventricular outflow tract obstruction. Can you break those down a bit?
Sure. Mitral insufficiency just means the mitral valve, the one between the left atrium and left ventricle, doesn't close tightly.
So blood leaks backward.
Yeah, back into the atrium when the ventricle contracts.
Oh.
The changes in the heart muscle, especially those little papillary muscles that control the valve, can cause this.
Okay. And the outflow tract obstruction.
That's when the thickened muscle itself, sometimes along with the mitral valve moving abnormally, actually blocks or hinders blood from leaving the left ventricle properly on its way to the body.
So it physically gets in the way of blood flow out of the heart.
Correct. Dynamic obstruction, because it often happens during the contraction phase.
Got it. So these are downstream consequences of that initial thickening. Now, who actually gets this? The source talks about signalment. What does that tell us?
Signalment is just the typical profile, age, breed, sex of affected animals. But remember, HCM in dogs is rare.
Right, so the data might be a bit limited.
Exactly. But what we do see suggests it tends to affect younger male dogs more often, like under 3 years old.
Huh. Young males. Are there particular breeds we should be aware of?
Yes, the source lists a few that seem overrepresented. Rottweilers, Dalmatians,
Okay.
German Shepherds, and Pointers too. And it also specifically mentions mature Boston Terriers.
Mature Boston Terriers. That's interesting. A bit different from the young male pattern for the others.
It is. It highlights that while there are tendencies, it's not perfectly uniform. But seeing these breeds pop up does hint towards a possible genetic component, even if we haven't nailed down the specifics yet.
Right. Still suggests something inherited might be going on.
Right.
Okay, so how would someone even know if their dog has this, especially if it's often silent? What are the clinical signs?
That's the tricky part. The source is clear. Most dogs with HCM show no signs at all. Asymptomatic.
So it could be found completely by accident.
Often, yes. During a routine checkup, maybe they hear a murmur, or it's found during screening for something else. Or, sadly, sometimes the first sign is something serious.
Okay. But for the dogs that do show signs, what would an owner notice?
When symptoms appear, they're usually linked to left congestive heart failure developing.
Okay, so things like...
Well, the history might include syncope fainting spells, especially during or after exercise. That's a big red flag.
Sure, ting, okay.
And this is concerning, but the source says sudden death is actually the most commonly reported clinical sign.
Wow,
Oh,
that's really sobering. It can just happen with no prior warning.
In some cases, unfortunately, yes, it highlights the potential severity.
Absolutely. What about things a vet might pick up during an exam?
On the physical exam, a vet might hear a systolic heart murmur, that whoosh sound,
Right.
or maybe a cardiac gallop rhythm, which is an extra heart sound. And if heart failure is present, then you'd see the more classic signs: coughing, trouble breathing, maybe that bluish tint to the gums.
Cyanosis.
Yes, cyanosis, and just general exercise intolerance. They tire out easily.
Okay. A lot of those sound like they could be other heart problems too, which brings us back to the cause. You mentioned it's largely unknown in dogs.
That's right. The exact trigger for HCM in dogs isn't well understood. Big contrast to humans and cats where, as we said, specific gene defects and heart muscle proteins are often found.
And we just haven't found those equivalents in dogs yet.
Not the specific ones, no. The source mentions a genetic basis is suspected, because it hits certain breeds and often young dogs.
Right, the patterns suggest it.
But the actual genetic flaws haven't been identified across the board, so we can suspect it, but we can't definitively test for it genetically in most cases, which makes breeding advice harder too.
I see. So if a vet suspects HCM based on signs or a murmur, how do they confirm it and make sure it's not something else?
Diagnosis involves ruling out other possibilities, what we call differential diagnosis. Very important.
Like what kind of things?
Well, systemic hypertension, high blood pressure can cause the heart muscle to thicken too, so you need to rule that out.
Okay, makes sense.
Also, other diseases that might infiltrate the heart muscle, other reasons for congestive heart failure, even things like an overactive thyroid or congenital valve problem.
So check the blood pressure, maybe run some blood work.
Definitely check blood pressure. And then imaging becomes really crucial.
X-rays.
Chest x-rays, yeah. They might look normal, especially early on, but they can show if the left atrium or ventricle is enlarged, and critically, if there's fluid in the lungs, pulmonary edema, which indicates congestive heart failure.
And I assume the gold standard is echocardiography, ultrasound of the heart.
Absolutely. Echo is key for HCM. It lets you actually see and measure the heart walls.
So you'd see that thickened left ventricle wall.
Typically, yes. You'd see increased thickness. The papillary muscles might look enlarged too, and in more severe cases, the left atrium is usually bigger.
Can the thickening be in specific spots?
It can, yeah. The source notes it can be diffuse, like all around, or more localized to certain segments of the ventricle wall. Even mild cases might just show subtle thickening.
And does echo help spot that outflow obstruction issue too?
It does. A common finding is something called systolic anterior motion of the mitral valve, or SAM.
Sam.
Yeah, where the mitral valve leaflet gets sort of pulled forward into the outflow tract during contraction. Seeing SAM is a strong indicator of that dynamic obstruction.
Okay, so echo gives a really detailed picture. What about other tests, like an ECG?
An ECG, which looks at the heart's electrical activity, can be normal. Sometimes you see certain changes, like in the ST segment or T wave, that hint at muscle disease. But interestingly, the source says significant arrhythmias, irregular heartbeats, are actually pretty rare in dogs with HCM.
That is interesting, maybe different from HCM in other species.
Potentially, yes. And as we mentioned, blood pressure is usually normal in dogs with primary HCM, but you measure it to rule out hypertension causing the thickening.
Got it. So it's a combination approach to nail the diagnosis. Now, switching gears slightly, what do pathologists find if they examine a heart after a dog is passed?
Well, post-mortem findings confirm the diagnosis. They often find an increased heart weight relative to the dog's body weight.
So the heart is physically heavier, bigger than it should be.
Right. And you obviously see the thickened left ventricle walls very clearly. The source also mentions an impact lesion, sometimes seen on the septum, the wall between the ventricles.
An impact lesion. From what?
Likely related to that outflow obstruction, maybe where the mitral valve hits the septum. And the mitral valve leaflets themselves are often thickened and elongated.
Which would contribute to the leakiness, the insufficiency.
Exactly. And as you'd expect from the pressure changes, the left atrium is usually enlarged to some degree.
Okay, paints a clear picture of the structural changes. So let's talk treatment. A dog gets diagnosed. What happens next?
Management really depends on the situation. Most dogs, if they're stable and not in heart failure, are managed as outpatients.
Okay. Any general recommendations?
Lifestyle changes are usually advised. Things like restricting really strenuous exercise to reduce the heart's workload,
Makes sense.
and often a lower sodium diet to help manage potential fluid retention down the line.
Right. And when do medications come into play?
Generally, meds are started if the dog shows signs of congestive heart failure, or if they have significant arrhythmias, we said those are rare, or if they're having frequent fainting spells, it's the syncope.
Okay. And if they're in heart failure.
Then the standard approach is diuretics, like furosemide, to get rid of excess fluid,
Lasix. Yeah.
and ACE inhibitors. Those help relax blood vessels and reduce the strain on the heart.
Okay, standard heart failure stuff.
Yeah.
What about those other drugs mentioned? Beta blockers or calcium channel blockers?
Yeah.
Especially if there's that outflow obstruction?
That's a bit more debated in dogs. They're sometimes used to try and lessen that obstruction gradient, slow the heart rate, improve relaxation. But the source points out that their actual benefit for that specific purpose, the obstruction, hasn't been definitively proven in dogs through big studies, not like in people or cats.
So, used sometimes, but maybe the evidence isn't as strong for dogs.
Kind of. However, they can still be helpful for other reasons. Like you said, slowing the heart rate if it's too fast, potentially improving oxygen supply to the heart muscle, helping relaxation, maybe controlling arrhythmias if they do occur. So they might still be used possibly more for those general benefits, especially if heart failure is also present.
I see. It's about looking at the whole picture for that dog. Are there any drugs that are definite no-nos? Things to avoid?
Yes, absolutely. Positive inotropes, drugs that make the heart contract harder, like pimobendan in some contexts, are generally avoided because they could actually worsen that outflow obstruction.
Right, make the blockage worse.
Exactly. Also, combining calcium channel blockers and beta blockers is usually cautioned against because together they can slow the heart rate down too much.
Dangerously slow.
Potentially, yeah. Bradycardia. And strong drugs that primarily dilate arteries should be used very carefully, if at all, if there's significant outflow obstruction. But milder ones, like the ACE inhibitors, are usually okay, especially for heart failure.
Okay, so medication choices need careful consideration based on the specific heart changes. How about follow-up? How often do these dogs need to be checked?
It really varies depending on how severe things are initially and how the dog is doing on treatment.
Makes sense. More severe means more frequent checks.
Pretty much. The source says repeat x-rays and especially echocardiograms are really valuable to monitor how things are progressing or hopefully stabilizing and to see if medication adjustments are needed. You track the heart size, the function, look for fluid.
Right, keeping tabs on it. Which leads to the big question, prognosis. What's the long-term outlook?
That's tough. Because HCM is relatively rare in dogs, we don't have the same amount of long-term data as for more common conditions.
So predicting for an individual dog is hard.
It is challenging. The source states the prognosis is generally considered guarded for dogs that already have severe congestive heart failure or other major complications like frequent fainting or severe obstruction.
Guarded. So, serious, but maybe variable.
Variable is a good word. Some dogs might live quite a while with management, others might decline more quickly, and then there's that risk of sudden death we mentioned. The lack of understanding of the root cause also makes prognosis tricky.
So it really underscores the need for ongoing monitoring and adjusting care as needed. The rarity makes it harder to give definitive answers.
That sums it up well, yes.
Okay, well that was definitely a deep dive into canine HCM using our source material. Key takeaways seem to be: rare condition, thickened left ventricle, cause often unknown in dogs unlike cats or humans.
Right. Often asymptomatic, but can lead to heart failure or sudden events.
Diagnosis relies heavily on echo and ruling out other issues.
And treatment focuses on managing symptoms, especially heart failure, with some debate around drugs for outflow obstructions, specifically in dogs.
And the rarity impacts our ability to predict long-term outcomes clearly.
Exactly. It highlights the challenges we face with less common diseases in veterinary medicine. Research is ongoing, but answers take time.
Absolutely. And that brings us to a final thought for you, listening. Think about these rarer conditions in animals. What are the hurdles for researchers, for vets, for owners, when maybe the knowledge base isn't as vast or treatment options aren't as clear-cut?
Yeah, and maybe consider how advancements in human medicine, where HCM is better understood genetically, might filter down to help dogs. Or even could studying these conditions in dogs offer unique insights back to human cardiology?
Definitely food for thought. Thanks for joining us for this deep dive.